Hello, everyone. It's a pleasure to welcome you today. Let me just start by introducing myself. My name is Ariana Bardawil, and I'm a data scientist working for the government of the City of Buenos Aires. I'm part of the Health Information and Statistics Office, or GOGIES for its acronym in Spanish.
And my name is Asia Martinez. I'm a data analyst, also working for the government of City of Buenos Aires. What we would like to present today is an automatization project of Sumar program. As we know, public health care system face growing pressure to do more with fewer resources. So cost recovery programs can play a key role in supporting sustainability in the long term. This topic is particularly relevant because it shows how an administrative process optimized through data science and open source tools like R can have a positive impact on public health institutions.
Before diving into the technical details, let me quickly place our team on the map. On the right-hand side, you'll see a short clip zooming into the autonomous city of Buenos Aires in Argentina. And on the other side is a simplified or chart that shows where our office, information and health statistics management, fits inside the Ministry of Health.
To understand why the Sumar automation is so valuable, we first need a quick tour of Argentina health care landscape, which is fragmented. First, the three subsectors are the public sector, a network of national, provincial, and municipal hospitals that guarantee free universal care regardless of insurance status. Social security sector, payroll financed horas sociales that insure former workers, plus special funds for retirees and people with disabilities. Coverage here is mandatory for anyone in a formal employment or receiving a pension. And last, we have the private sector, voluntary prepay plans that individuals can purchase on top of or instead of the other two. In this context, Sumar is a national program that was created to support the uninsured population by strengthening the public subsystem and providing financial incentives to health providers each time they detect a new patient with public coverage alone.
The Sumar program is a national policy aimed at improving public healthcare, financing based on the services actually provided to people without health insurance. The central axis is a result-based funding model that allocates resources based on service provision and health system performance. The funding comes from the World Bank and it is transferred to jurisdiction based on three key components: identifying individuals with public coverage alone, delivering essential health services known as basic effective coverage, and achieving health outcomes measured through key health indicators.
Everything we've described so far only works because we have a reliable data flowing out of the hospitals and into our analytics stacks. In Buenos Aires City, the hospital management system, known as CIGEOS, is the main source of data for the public health subsystem. CIGEOS is a single integrated platform that handles both administrative and clinical workflows. It has dedicated modules for patients registration, outpatients and inpatient encounters, prescriptions, lab orders and results, imaging, and more. Each model writes to a single transactional database, so every public sector facility uses the same data language. What happened next? Nightly, ETL's jobs extract the most relevant tables, patient encounters, diagnostics, procedures, labs, and load them into GOGIE's central data warehouse, which powers our automated Sumar workflow.
In Buenos Aires, our team at GOGIES plays a central role in automating this process. We focus on identifying patients with prioritized a condition and verifying the health services they receive, based on records from the health information system. The main outputs of our process are PDF invoices, weekly Excel reports, and performance indicator summaries. These are generated through three key stages: enrollment, detection of basic effective coverage services, and the analysis of health performance indicators.
To work with all this information, we can on our own data infrastructure and tools. We have a dedicated R Studio server used by the data science team to automate processes and to generate reports. We also use GitLab for version control and collaborative development. All the data we use is stored in a dedicated data warehouse, which we access through dbPlayer. This allows us to query tables, transform data, and prepare it for reporting and analysis. A key component of our workflow is an internal R package called a Ahiser that we developed. It includes custom functions to process data. We also use libraries such as Air Markdown, OpenExcel, Janitor, and Stringer. Also, we use OnCloud as a secure file sharing platform to distribute the outputs across the ministry.
Here's how the process works from end to end. We start with medical visits recorded in CGEOs during the reporting period. Then we check, does this patient have public coverage alone? This is based on two national registries, the Federal Unified Register of Beneficiaries called PUCO and the Sumar registry. If the answer is yes, we apply regex and logic rules across multiple data sources to detect eligible health services. We enrich each case with reportable fields like vital signs and anthropometric values. Then, using R Markdown, we automatically generate the required PDFs and tabular files for submission. These files are delivered back to healthcare providers by OnCloud. But if the patient doesn't meet a criteria, the visit is excluded. This pipeline runs entirely in R, using tidyverse, string R, writeXL, and tiny text. So it's open source, reproducible, and fully auditable.
Finally, this time series shows the number of health services detected automatically from January 2021 to April 2025. What stands out is the steady increase in volume, not just due to more services being delivered, but because our automatization has become more robust, scalable, and comprehensive. Every dot here represents real services for real patients turned into real funding for the public system without manual intervention. It's a sign that automatization doesn't just save time, it also expands coverage and strengthens accountability.
Thank you.
Thank you.
Well, thank you. That's really neat to see this in use. Are you largely tracking and reporting data for national authorities or local authorities?
Yes, we work for a team which, with our reports, make indicators to give them to the Ministry of Health of the nation of Argentina.
And
all the reports travel to the Ministry of Health of nation.
I'm assuming at times the Ministry of Health makes interventions to try to improve outcomes, whatever those might be. Can you track those with things like GGQC or QI charts to see the outcomes over time?
We are not the team who works directly with the program, no, with the Sumar program. We are a team in the Ministry of Health that are dedicated to the statistics and the reports that needs other areas in the Ministry of Health of the Buenos Aires city. So we don't have the contact with the authorities of the Ministry of Argentina directly. There are other areas that made this auditorías, no sé cómo es en inglés.
Right. And Do you use either our Markdown or Corto to generate reports?
Yes, we use R Markdown
Okay.
to the PDFs and invoices.
Right. And in terms of what your ministry wants in terms of data, are they kind of moving to, more plots, or are you doing a lot of tables? I mean, traditionally, we do a lot of tables in the health area in the US.
Our reports are principally Excels tables, and in the PDFs are tables with cable extra or other or libraries with beautiful tables.
Mhm.
But we don't have dashboards or other kind of visualizations.
Yeah, it might blow their minds if you started giving them Corto dashboards to play with or shiny apps. But might be a fun future state. That would be neat. Well, we are at 3:33. So any last questions, please put them in for Dacio or Ariana. And at 3:34, the Richard Hanna talk on swimmer plots with GG Swim will start. So make your way over there for the next session.